I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, this is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center in Long Island, New York. So it's October, mid-October, a little chilly this morning. First case of the day, we're going to show you two cases today. This is number one, first case of the day on this gentleman. Now, he is a redo. I did him 2 years ago. 2 years ago, he's in his mid to late 50s. He's locally from New York area. And I used my very old technique. I used Smart Lipo, which was that light lipo now with the wavelength that you see the light going through. And I used it in the incision, and you hardly can see it, but it's right here on this side and right here on this side. And I used my old technique. Really, I've advanced quantum leaps from what I used to do 2 years ago. Number one, no more Smart Lipo. I do only VaserLipo. Number two, I don't do regular lipo and concentrate just around here. I do Hi-Definition through my stealth incisions right over here and of course over here, not here anymore. And the incision by the nipple is the same. Now, if you lift up here, he's got no gland here anymore. The glands are gone. So this is a revision. This is a revision, and my surgeries are guaranteed, and there's no surgical charge for my revisional surgery because I guarantee my results forever. He had his surgery 2 years ago. He called me up recently. He says, I want Mo better. I want Mo better, and I'm going to give him Mo better. Stealth incisions now here, Vaser, all of this. I don't just concentrate here, I concentrate here. I'm going to show you now his pre-op photos now. And you can see by the pre-op photos that his right chest was twice the size of his left chest. Right chest, left side. And again, the right chest is bigger than the left side. What I don't like about what I used to do through here, he's got this crease here, and that's through the incision down over here. With my new technique, I go here and I sculpt all the way around that edge of the pectoralis major muscle. I now include way over here. So before I just did kind of here and there, now I go way to the lats. So all of this will be gone. I want to contour the shape over here. Do not have to go up here. Do not have to go by the nipple. And again here, I want to go right over here through my stealth incisions here. Again, there's no gland. Do not have to make the incision here. It's quicker, it's easier, quicker recovery, less post-op discomfort. Within a day, he'll be great. And he'll continue to exercise and diet, lose a little weight, eat better, exercise more. And we're going, what's that?
More confidence.
More confidence, and we're going to hit
lots of golf.
A home run. No, not golf. A hole in one by golf or a home run by baseball. With my black pen, I'm going to frame him. It's called framing. So I kind of take this like a picture frame. I frame where I want to go. So come here, get that little rhomboid here. Do not want to go above this line. I want to maintain shape here. And that's the pec line right there, the pec line right here, and the pec line. So it's like a frame of a picture right there. Let's give him a little deltopectoral groove while we're at it. Deepen that for him. Good. So that's framing it like a picture frame. Now, once I frame it, I paint by numbers. So I color it in. This is blue. Can't really hardly tell. This is the transition zone. This is what I'm going to show you in a minute. I'm going to scoop them right here. Scoop them out. Turn that way, my man. Scoop them right here. Get all this deep. Lats back here. All this deep. All this deep. Now I'm going to Colombia in like 2 weeks.
Wow.
To learn from one of the masters in this operation. So
really?
when I come back in a couple of weeks, I will have more information and more technique and more technology, and even almost seems impossible, but even be better If that's possible. I don't know if that's possible. Here, put you on that. So now remember, this is a revision, so we don't have to make any incision in the nipple there. That's perfect. That's my old incision. Right now, I don't do that anymore. All the plastic surgeons, when they do lipo, do it down here or do it down here. I now do it where that red mark is. So we're going to start on this right side and pump you up. Pump you up. This is a redo, so he's got underneath the nipple some scarring, but this one ring gets through that like a knife. Deltopectoral groove. So here we go this side. This side's a little bit tighter. So let's see how we break up this scar tissue, but I have no qualms that I won't be able to do it. Because I am the best.
Yes, you are. You made a big difference in my life from the initial operation 2 years ago. I will never ever go to the beach. I never change my clothes in the locker room. I'll go to the beach in my t-shirt.
And I'll give you a quiz. What does the one ring do? Does it A, shrink the skin? Does it B, act like a knife? Does it C, give me a C.
Act like a grenade?
Act like a grenade? Or does it D,
Suck the fat out?
suck the fat out? What?
Who are you asking the question to?
To my audience.
Oh.
D? No! Vaser does not suck the fat out. The one ring acts like a knife. B.
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 It's a bigger ring to the...
Bigger ring, more rings. So what it does, the 5 ring, does it A, act like a knife? B, suck the fat out? C, you get free McDonald's for life? Or D, act like a grenade? And the answer is D, acts like a grenade and tightens the skin. Okay, so here we go. This is my curved cannula, so look what I can do. Look what I can do. Look what I can do. This is curve and curve. Down. Turn to the lefty. The baby cannula. The bambino. So once again, Dr. Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center. We did a touch-up. Greed is good, like Gordon Gekko says. Greed is good.
Greed, for lack of a better word, is good.
He had it done 2 years ago with my old technique, the smart lipo with the light. I did it through the incision here, and the results were good. He said himself, he changed his life, but he wanted mo better. He wanted agreed. He wanted better. So he called me up. I did it 2 years ago. I said, come on down. He spends half of his life down in the islands, all over the place, and half up here in New York. And he's on the beach playing golf. He wants to wear those tight golf shirts and feel good about himself. And so greed is good. He wanted better. So now my new technique with my Vaser, look what I got. This is just over 1 liter of more fat that I sculpted because it's been 2 years. My confidence is better. I hug. My technology is better with the Vaser. I sculpt. I've got my curved cannulas, my baby cannulas, my serrated cannulas, my power cannulas. Everything's better. It's like night and day, quantum leap difference than what I did 2 years ago. So most plastic surgeons do it what I did 2 years ago. Now I am better. And look at the results already. He's still got swelling, but he's got amazing. Kind of make your muscle. See that? Look at that. Look at that. See the muscle? It looks amazing. And when it tightens and when it, and he's gonna work on himself even better. I did my stealth incisions in the armpit. No incisions here because he doesn't need any. And he looks great. The touch-up was, it was all right, right?
Great.
It was great, yeah. So as I always say, you got gynecomastia, who you gonna call? Like Ghostbusters. Who you gonna call? Call me, Dr. Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center in Long Island, New York. Just a stone throw from Manhattan, from around the world, from around the country. You fly in, you do it, stay about 48 hours, and you go home, and we Skype or FaceTime for the consultation. 631-424-0101, 631-424-0101. Thank you, and see you soon.